Okay, in this video, we'll talk about the mechanism of Digitalis. Digitalis is a drug which is obtained from the plant foxgloves. Okay, foxglove or Digitalis purpurea. Now, initially, Digitalis was used to treat dropsy. In ancient times, Digitalis was used to treat dropsy. Dropsy is nothing but old term for edema. Later, upon subsequent investigation, it was found that Digitalis is most suitable for the treatment of edema which is caused by heart failure. Basically, right sided. In right sided heart failure, there is build up of fluid in the lower extremities. So, for example, legs. Okay. So, in such case, digital has been found to be more useful. So, now we'll see how it works. Say this is a cardiac myocyte. Okay. In the cardiac myocytes, there is one ATPase channel that is called basically sodium potassium ATPase. The role of this ATPase is to take out three sodium ion outside the cell in return of two potassium ion. Okay. Now this is a normal physiology since there is a flux of sodium ion and influx of potassium, so this will create the resting membrane potential. Okay, this will establish the resting membrane potential within the cell. This is a normal physiology in normal heart. In case of heart failure, in case of patients whose heart is unable to pump sufficient blood, in such case what you need to do is we need to strengthen the heart muscle, so that it can pump enough blood record for the body. Sorry. So for such case, digitalis can be used. Digitalis has a potential to block this channel. Okay, when the sodium potassium ATPase is blocked, this will leads to rapid buildup of sodium inside the cell. Since sodium is unable to go out, so there is rapid buildup of sodium within the cell. Now whenever there is buildup of sodium within the cell, it will activate another exchanger that is called sodium calcium exchanger. Okay, now see, since there is excess sodium within the cell, so the body tries to get rid of this sodium from this cardiac myocyte. While doing so, it will take off calcium. Okay, now this excess calcium will go and stored into the sarcoplasmic reticulum of the cardiac myocyte, and during subsequent contraction, more of the calcium will be available to bind with the troponin C, and hence a strong contraction. So, in a nutshell, the therapeutic use of digitalis is number one, positive ionotropy. Okay, since there is a strong contraction. Number two, increase in the ejection fraction of the blood. And number three, we have reduction in the preload. Okay, number four, we have reduced pulmonary congestion. So this is all about digitalis. Thank you.